Dear students, welcome back. Now we are going to see another atypical vertebrae, that is the second rib. And now we will see the characteristic features or distinguishing features of the second rib. Here, this rib has no twist. The rib has no twist. So, both ends of this rib touch any plane surface upon which it is kept. So, both the ends will touch if you place this rib on an horizontal surface. Okay, and it has slight angle. It is having slight angle which lies near to the tubercle. Okay, same thing. This one also having this anterior end, posterior end, and the shaft. The shaft is not twisted here, and it is having a small angle which lies very close to the tubercle. Okay, and if you see the length of this rib it is 2 times more than the first rib. That means it is about twice as long as first rib. The head has small facets, and it also bears 2 facets. One is the superior as well as the inferior facets in the head. You can see in the head it is having 2 facets here, and the neck is very small. Here neck is small, and the tubercle is divided into articular and non-articular parts, and the non-articular part is smaller. And it is having 2 surfaces. One is the external surface. So this is the external surface and internal surface. Here we can see the external surface. So the external surface faces upwards and slightly outwards. Upper surface faces upwards and slightly outwards. And this external surface is convex. And it is also having a rough impression behind its middle. So here, so almost all this is the middle part. Behind this middle, you'll have a rough tubercle here. This tubercle gives origin to the lower part of first and the entire second digitation of serratus anterior. Simply we can say that it is having a rough impression behind the middle, and it gives attachment to the serratus anterior muscle. And coming to the internal surface, so definitely the internal surface is smooth and concave, and it is faces downwards and slightly inwards, just opposite to the external surface. So the external surface is facing upwards and slightly outwards, whereas the internal surface faces downwards and slightly inwards. So it is having an external surface and internal surface. So the internal surface is concave and the external surface is convex. Behind the middle it is having a rough impression which gives attachment to the serratus anterior in the external surface, whereas the internal surface is smooth and concave and faces downwards and slightly inwards, and there is a short costal groove in its posterior part. So at the inner side, at the posterior aspect, it is having a small groove. For costal groove is present at its posterior part, and the outer border. So actually here the posterior part of the rib is divided into it is having an upper border. The posterior part of the rib will have an upper border, and this upper border has two lips. One is the outer lip and the inner lip. Outer lip and the inner lip. So this outer lip is present just in front of the angle. Just in front of the angle, and it is rough. Okay. So the posterior part of the upper border, the posterior part of the upper border is having two lips. One is the outer lip and the inner lip. So the outer lip is present just in front of the angle, and which is rough. So if you have any rough part on the bone, that means it gives some attachments. Okay. So the outer border just in front of the angle is rough for insertion of scalenus posterior muscle. Scalenus posterior muscle. So the scalene is having anterior fibers, posterior fibers, and the middle fibers. The scalene posterior fibers are getting attached to the outer border of the upper border present on the posterior part. Okay. And it is behind this. So behind this outer border, behind this scalenus posterior in front, and behind this it is giving insertion to the serratus posterior superior. Serratus posterior superior. Now, how many muscles have or attached to this rib? One is the serratus anterior, and here it is giving attachment to the scalenus posterior, and behind to this muscle it gives attachment to the serratus posterior superior muscles. So these are the attachments, and the attachments at the posterior end, are same as typical rib. That means it is attached to the vertebra, and this one is tubercular, articular part is attached with the transverse process, and everything is same as that of the typical rib. So this is about the second rib, which is one of the atypical ribs present in the thorax. Thank you.